So the main CVR difference is twofold. One, because of our training program, we're the first program to actually have a 12-month graduate medical education program focused solely on teaching the next generation the best practices in venous disease. The second major difference is because we conduct clinical research, we actually analyze our outcomes. And then we present our data at the national meetings and publish it in peer-reviewed publications. And we're setting the standard for treatment going forward. So we're teaching other doctors what to do when it comes to patients who suffer from chronic venous disorders. And as a result, we're true national leaders and we're true thought leaders and true experts in this disease because we're setting the standards that other people follow. That's the main CVR difference. We train, we analyze, we research, we're constantly looking at our own results to see if we can do something better. We publish it and we share it with the rest of the world so that we can move the field forward.